Hello and welcome to my channel. This is GBM Warriors. My name is Kenny Verdon. I wanted to start this off by talking a little bit about myself and what I'm going through. A 51-year-old male, and in March of this year, 2022, I was diagnosed with a GBM, which is a glioblastoma multiforme brain tumor, which is the most aggressive brain tumor out there. I have stage 4 wild type, which is really bad. It's like the worst you could possibly have. But I started this channel to kind of talk about my cancer journey and what I'm going through, and maybe help some other people that are going through the same thing. So that's what I'm doing. This is my first video. So what we're going to do is I'm going to give you a little bit of background of who I am and what's going on. Like I said, a 51-year-old male. My whole adult life, I've worked in the medical field. I started out high school. I became an EMT, worked in an ambulance, went to school to become a surgical technologist, which is the guy that, hands instruments and stuff in the operating room. I transitioned from there to becoming a surgical first assistant, which means I'm the guy that helps assist the surgeon during surgeries. I've done every kind of specialty there is in the operating room, from orthopedics and general surgery to neurosurgery and heart surgery. I've specialized the last few years in heart surgery and neurosurgery. So I have a pretty extensive background. I've been doing this since 1990. So 32 years I've operated, been in the operating room. I've done tens of thousands of operations, literally, and worked all over the country at 18 different facilities and worked with over 500 different physicians over the years. Some of them the best in their field that have actually written the textbooks that tell people how to do these things. So I have an extensive knowledge of medicine, especially as far as surgery is concerned. However, I'm not trying to give any kind of medical advice on this channel. Talk to your doctor, talk to your oncologist, talk to your surgeons. I am not here to give medical advice. I can tell you what I've gone through and what I've experienced, but I'm not going to give medical advice. I'm going to refer you back to your doctors for that. I'm a medical professional as far as surgery is concerned, so I can tell you about surgeries, things like that, but I'm not going to give you medical advice as far as what's going on with your GBM or your cancer or whatever. I'm just going to tell you my experiences. So on that line, I've obviously worked in the medical field for a very long time, so I've seen lots of things, and I know that having a GBM, when you hear that in the operating room, when you hear someone that has a GBM, it's a devastating disease. It's a death sentence is what it is. And unfortunately, that's what it is. There's not very many treatments for GBMs, and I will do a separate video about what a GBM is and the statistics that are involved later. But what I'm going to do now is I'm just giving you a background of who I am and what's going on, and I'll talk you through what I've been through. So up until now, when all this started, I was working up in Grand Junction, Colorado. I'm from Amarillo, Texas. That's where I'm at right now. But I had taken a position in Grand Junction, Colorado, where I worked with a group that we basically provided first assistance for the heart group that worked up there. And so the guys that I worked with, we rotated through up there. I worked up there for 2 weeks, and then I was off the rest of the month, which was a pretty sweet deal for someone that's been in the field for 30 years. To be able to basically work part-time. I worked 2 weeks and then off the rest of the month, which is a sweet deal. And they paid for everything as far as my housing, travel, all that kind of jazz. So it was a really nice deal for someone like me that's been doing this for a really long time. But I was up there working, and it was actually on my birthday in March. We were doing a huge complicated case, and I started having issues where I couldn't use my left hand, and I couldn't do fine motor movements, which for me, doing vascular surgery and working with small sutures and things like that, taking vein out of a leg, that kind of thing, I need my left hand very, very badly. So I was doing a case, couldn't use my left hand very well, so I was struggling really bad. However, during that time, we had worked a whole bunch that week, and this was in the middle of the night, so I attributed it to just being exhausted and tired. But so on that note, I had to leave that case. I got relieved out of that case by one of my colleagues, and then I had to catch a plane back to Amarillo. So I got 0 sleep that night. And then when I got back to Amarillo, my wife had planned a trip to go to Lubbock, which is a couple hours away from us, for my birthday, to kind of celebrate my birthday. So basically, as soon as I got home, we got in the truck, went down to Lubbock, and had a really nice dinner at a nice place, and then went and played a little golf, and then went to the hotel. And when we got to the hotel, I could not sleep. I couldn't lay flat because I couldn't breathe very well. And hindsight, it was because the left side of my diaphragm was paralyzed. I'll get to that in a little bit. But so I couldn't sleep that night. We came back the next day, which was a Sunday, came back to Amarillo, and I was able to actually lay down and take a nap that day. But then that night I couldn't sleep again, so I came and slept on the recliner in the living room, and did not do well that night. My dog, he's like 8 or 9 years old, he would not let me sleep. He kept bugging me all night long. And the next morning I woke my wife up and said we need to go to the ER. So we went to the ER. By the time we got to the ER, I could barely walk. And my wife and I thought I was having a stroke. And because that's the symptoms that were presenting. My left side was pretty much paralyzed. I couldn't hardly walk on my left leg wasn't working right. My left arm wasn't working right. I was having trouble breathing. So when we got to the ER doctor went in there and thought the same thing, thought I was having a stroke. So we did stroke protocol, which was a CT scan. Got a CT scan. And, sometimes the doctors try to sugarcoat things and tell you how things are. This guy did not, and I really appreciated that. He just walked in and said, "You got a tumor in your head." And for someone like me that has been in the medical field, I'd rather than be up like that than try to sugarcoat things. Me being who I was, and my wife is also a first assistant, so she's done the same job I have for 25, almost 30 years now also. So we know all the surgeons in town, we know all the docs in town. And so the surgeon that was going to come see me, I've known since he came out of residency. Worked with him since day one when he came out of residency. And so we knew him, he knew us. But I needed to have an MRI done before he really could see what was going on. CT scan showed a tumor, but I needed an MRI to verify what was going on. So I couldn't lay flat still, so we had to wait till the next day to get an MRI so that I could be sedated, so I could lay flat and lay still enough to have an MRI done. And then once I had the MRI done, Dr. Gentry came and saw me, and he really didn't want to come see me because, we know each other, and he knew that what was going on was bad. However, looking at the scans and things like that, we originally thought that it was an infectious cyst, and that's what we were thinking when we went in. So going into my first surgery, which was March the 24th, we thought we were going in there to take out an infected cyst and try to figure out if it was, what kind of infection it was, so we could get me on the right antibiotics. So on March the 24th, I had my first surgery, and that's where I'll go with my next video. We'll be talking about my first surgery and the diagnosis and things like that. Okay, so stick around for the next video, and I'll talk about my first surgery. Thanks for watching.